I am your district governor, Ramesh Hariharan. As you know, we have formed a task force to combat coronavirus. We have competent experts in the medical field. We had a town hall webinar on March 20th. It was attended by over 300 Rotarians in our district. Our experts have been continuing their work diligently, gathering invaluable information for the benefit of our district membership and the world at large. Today's follow-up webinar is a sincere attempt to update you on the new developments and continuing challenges we are facing during this pandemic. Kindly note that we'll be addressing only medical questions, specifically those that are related to coronavirus prevention and treatment. Welcome to our second online town hall webinar with our panel of experts to discuss the challenges our communities are facing as a result of the spread of coronavirus. Over to the chairman of the task force, a member of the Rotary Club of Los Altos, Dr. Jack Higgins.
This is the second webinar that we've done as a project of the District 5170 Coronavirus Response Task Force. And the other one was 3 weeks ago tonight. If you want to watch that one, it's available through the district website. Just go to the District 5170 homepage and you'll see the link there. But I want to point out that you'll find some things are different. What you're going to hear today will be a little bit different from what it was 3 weeks ago because the world is changing very, very rapidly. And one of the reasons we wanted to plan to do this a few weeks out was that we knew that things would be very different by this time. And some of the advice that we were giving last time is modified a little bit now, partly because of the CDC's recommendation or the State Department of Public Health information. But things are fine-tuned a little bit, and we think we know more now, or we know that we know more now, a lot more now, than we did 3 weeks ago about coronavirus and COVID-19. But we have 4 experts in public health here, Dr. Richard Godfrey, Dr. Peter Sherris, Dr. Arthur Dover, and Aggie Freeman, who's a registered nurse and an expert in public health and occupational health. And frankly, Aggie knows more than most doctors who aren't specialists in those fields, so we're delighted to have her on the panel with us today. The next thing I wanted to mention is the disclaimer that's up on the screen now. This is a legal document, and we're supposed to do this sort of thing, but more importantly than that, I want to point out that this really is a snapshot into our knowledge base right now of a number of experts who've been combing the web and looking at all the sites that we respect, places like the Johns Hopkins map and the State Department of Public Health, the CDC, places where we can find good information, UCSF, Stanford. And that's part of the purpose of this whole thing, the whole task force for that matter, is to provide Rotarians in the district and anybody else who wants to listen and watch us with information that's unbiased and straightforward and well thought out and well verified. So again, keep in mind, the point of the disclaimer is that things will change again. Things are different from 3 weeks ago. They'll be different again tomorrow. So don't make major medical decisions based on what we're saying tonight, but instead talk to your own doctor if you can get a hold of them. If not, you can try another alternative, such as trying the nearest hospital or your nearest county hospital. Or you can dial 211, which is something I wasn't even aware of until 3 weeks ago when we started talking about doing a webinar. 911 is for emergencies. 211 is for asking questions about healthcare, mental health care, or anything else for that matter. It's a great source of general information and the place to call if you have health-related questions that aren't emergencies. But most importantly, if in fact you have a life-threatening emergency, dial 911. And with that, I'll hand it off to Dr. Richard Godfrey.
Good afternoon, fellow Rotarians. It's an honor and a pleasure to be here with the 5170 webinar. And by background, I'm with Niles Rotary. I have worked primarily at Kaiser and with the Alameda House System. Just partly by history, it was some time ago in 2015 that I went to Sierra Leone and worked with the Ebola crisis there. And so all of us have been through viruses. The Ebola one was a tough one, but because we came up with the right answers, and particularly the people in West Africa did social distancing and isolation, we were able to overcome that virus, and I'm confident we'll do that with COVID-19 as well. So let me just go through a few things that I think might be of interest. We've come to 6 feet as a balance between average droplet and vial range and what's socially manageable for us for separation. There's some debate today among the virologists as to aerosols and how dangerous they might be. In fact, there have been some studies showing they might go as far as 27 feet, but in reality, we think that 6 feet is probably a reasonable and fairly well accepted distance for what we should be trying for. And we'll go to the next slide. And masks. Well, obviously, next to social distancing, masks can be key. We do know that they block the droplets and spread of virus that come from the wearer. And we've learned even as many as 60% of infected people may be asymptomatic. That number has gone up a little bit after we got the data from the U.S. Theodore Roosevelt aircraft carrier, but generally somewhere between 25 and 60%. And more data may be coming out. We're obviously had some new guidelines on April 3rd from the CDC, and there may be some additional guidelines as we go forward. But one of the things I think we all understand is you still have to do social distancing. You still need to wash your hands. Masks don't take care of everything. Next slide. So here's an example of a mask that probably won't work. A little bit facetious, but here's one that can work, and that's a cloth mask. And you can design these and make these at home, and a lot of people are doing that. Next slide. So in order to put it on, it should fit snugly, comfortably. You can secure it either through the ties or ear loops. And there are different ways to make these, and you can add on some extra filtering as you design them, and some maybe a paper towel or different things of that type. And if you go online, you'll see many directions for how to do that. Next slide. And how often should you wash them? Well, routinely, depending on how often you're going to use them. And machine wash is considered to be the best probable method for washing. It can be hand washed. How do you safely remove it? Obviously, you try to avoid touching your eyes, nose, or mouth. And you, of course, want to wash your hands after removing. So I'm really happy to introduce Peter Sherris, who you're going to learn a lot more from. Peter.
So thank you, Rich. I have had the pleasure of working with Rich in Africa, and he's quite a remarkable fellow. So I happen to be the president of the Rotary Club of Oakland. I spent 35 years practicing internal medicine and cardiology at Permanente Medical Group. And after I retired, I went to UC Berkeley and got a master's in public health just in time for this crisis of the century, public health crisis of the century. Nothing like this since 1919. Next slide. I was asked to talk a little bit about testing. Testing is a huge issue. There are two different kinds of tests, and we don't have enough of either one. I saw an estimate a couple of days ago that we have about a quarter of the tests we need in order to really get a handle on this illness. Because testing is such a scarce resource, it really has to be used to make decisions. There just aren't enough tests for anybody that wants to go get tested to go and do that. So the tests that exist happen to be the PCR test. This is a test that searches for the virus RNA in bodily fluids. They put a swab into the back of your throat, they get some fluid, they take it in, they're actually looking at those secretions for virus RNA. This test has both false positive and false negative results. That means that if you get a positive test, you actually might not have the virus. And false negative. If you get this test done and have a negative result, you actually may have the virus. And that's why doctors, when patients are in the hospital, they think a patient's got COVID and they get a negative result, they do it again, and then they do it again until they finally get a test that goes along with what they think the patient has. And the same thing's true towards the end of the illness. That's why in order to be cleared, you have to have 2 or 3 tests done, at least 2, 24 hours apart, because you may get a negative one and then retest 24 hours later and get a positive one. And that's a function of the test and also the natural history of the viral RNA. Let's go on. So the other test is a serologic antibody test. This test is completely useless in an acute disease. It takes 11 days for a human being to develop antibodies to this virus. And so this is a test that's mostly important, learning how many people in your population have had the illness. It's an epidemiologic test. If you can discover that you've had X million people have it, then you'll know how prevalent the disease is in the population. And the most important thing is, because I know you can go out and get these tests, if you get a positive test, a test that shows antibodies, it does not establish that you are immune to this disease. As a 72-year-old, if I went out and got this test and it was positive, I should not change my social distancing. I should not be changing my use of masks. I shouldn't be changing anything in the way I do things. As of April 15th, there were 3 of these tests that were FDA approved. There are over 70 manufacturers who have FDA applications for these antibody tests, and there are over 90 unapproved tests on the market. They're being used in states, cities, they're being used in studies, and their accuracy is still being assessed. It is important that you assume that any test you as an individual can buy on the internet is likely a scam. There's a lot of scams out there. And we have a lot to learn about these tests. Next slide, please. So who should be tested? Now, I'm going to present you the current CDC guidelines, and I'm not going to go through this word for word. If you look at priority 1, 2, and 3, all 3 of those 4 categories of people have symptoms. That we don't have enough tests. What we need to be doing is using the tests we have to determine what people who are symptomatic have, with one exception, and that is priority 3, first responders and healthcare workers, whether they're symptomatic or not, are a 3rd priority for testing. Currently, if you don't have symptoms, you have no priority for being tested. Great. So I'll be happy to answer more questions about testing, and so it's my pleasure to introduce Arthur Dover.
Thanks, Peter. I'm pediatrician with many years experience, member of the Capitola Aptos Rotary Club, and my specialty these days is travel medicine. I'm going to talk about the involvement of children with the coronavirus 19 and the effects of the pandemic on children who don't necessarily have illness. At a study reported at UCSF, only 2% of the patients were under 18 years of age. So the children make up a very small number of people involved with this infection. And of those, only 2% had severe or critical disease. In this study of children, 25% were shedding virus but were not symptomatic. The others were having mild or moderate symptoms. The symptoms in order of frequency and severity for children are fever and cough. And those are the reasons to call the doctor, not go to the emergency room. And I mentioned diarrhea because the virus has been isolated in the stool of children that are infected. Children are vectors of this disease, again, without necessarily having symptoms. The household cluster showed that 10% of them were due to children who were infected but not necessarily sick in the family. Cloth masks are approved for children. Hand washing often needs to be assisted by the adult. Running water, liquid soap, although I imagine bar soap is just as good. Rigorous washing, of course, and ideally use a disposable paper towel for drying. Disinfection should be done with approved hand sanitizers only, and the wipes that are used to clean up after a diaper change are not effective. They should be avoided. Pandemic has had effects on many of the children in the country. In California, 43% belong to low-income category. This leads to food insecurity, a major problem. And I think this is where Rotarians can help. You'll see other suggestions at the end of our talk. There's stress and anxiety for the caregivers as well as the children, loss of family income, loss of usual routines because of not being in school, loss of daycare and safe environments, and tremendous parental stress. And this leads to increased domestic violence and possibly child abuse, including sexual abuse. I'm happy to introduce to you Aggie Freeman, a very educated and helpful for our program nurse from UC California.
Thanks, Arthur. I'm Maggie Freeman. I'm happy to be one of the panelists on the Coronavirus Task Force for Rotary District 5170. I'm an occupational health specialist and will be very involved in the return to work protocols of getting employers reassured that someone who may have had COVID is safe to return to work. Currently, I'm the club secretary for Rotary Silicon Valley Passport, and I serve the district also as Sergeant at Arms co-chair. I'm recently appointed as director for RotaCare Bay Area, which serves underserved populations in the clinics. One of the things that's important to understand in the public health intervention that we're doing with this new virus that came into the United States early in February is that there is a cycle of disease transmission for all infectious agents. In order to become infected with COVID-19, you have to come in contact with COVID-19. And we know that the majority of tests that we're seeing done, the tests are negative. So you can't get an infection from someone that doesn't have the virus. The virus has to be present in sufficient quantities. And as Dr. Godfrey was talking about, coughing, sneezing, handshaking, and coming in contact with some hard surface or desk or something is sufficient quantity. This virus is known to be about 6 times more infectious than the flu. In order to get COVID-19, it has to get in the correct portal of exit, and we know that that's a respiratory entrance, and the host must be susceptible, and there's a lot of research being done at UCSF as well as around the world on who is more susceptible. And we know that there are certain populations that have a greater susceptibility to COVID-19 than others. The droplet transmission, you can reduce your risk for exposure by wearing the face covering or mask, as Dr. Godfrey was talking about. Direct contact, frequent hand washing, especially before eating, especially if you're coming off from outdoors and you come in, that's one of the first things you can do to keep yourself and your family safe. And social distancing, like when you're grocery shopping or out in the community, also adds an additional layer of protection. What's really helpful is to know what the symptoms are for coronavirus, because it's flu season and allergy season as well, and the symptoms may confuse you. Coronavirus presents with a dry cough and a sore throat, and there's a mild fever, usually around 100 to 100.5, which may go up higher if the person's in an acute stage of the infection. We know that the symptoms appear as soon as 2 days after exposure, but that may be as long as 14 days after, although the majority of symptoms we're seeing in our community is at 2 to 5 days. In flu season, there's a runny or stuffy nose, and that's also allergy season. We do have a test for influenza. So if you are tested for flu, we can tell you go home and do some of the same things that we're recommended. Allergy season, if you're someone who's prone to allergies and you are also have a history of allergies, we know you can take Benadryl over the counter, and if those symptoms go away, then it's probably not coronavirus. So coronavirus is dry cough, may have shortness of breath, fever over 100.5. So we wanted to talk with you today about what to do if you're sick with COVID-19. And there are 3 populations. There's the population in the community who's exposed and won't show any kinds of symptoms. There's the population who will get sick. And then there's the population who are infected and need medical treatment. So we're going to talk a little bit about that. For the majority of people who are COVID-19 positive, this is a mild illness. 80 to 85% of people will have symptoms and recover without hospitalization. If you have mild symptoms, we want you to call or get online with your community primary care doctor and get advice from them and their recommendations. The doctor's going to tell you to stay at home, isolate from your family, stay hydrated, use Tylenol or acetaminophen if your fever's over 102. And because testing is not yet widely available, the doctor may or may not recommend you be tested. The thing that's really important to know is when you should intervene and see the doctor. If you're at home with someone who has COVID-19 and they are beginning to have difficulty breathing, if you can't wake them or they're disoriented or they're confused, or if their coloring changes from pink, their lips turn blue, that is a 911 emergency. And you do not need your doctor's permission to call 911. If you have questions that are routine, a lot of the doctors will have advice nurses and they will call you back. I think the most important thing is hydration. Currently, there is no specific treatment for home care for COVID-19, and this is disorienting for our community. For one thing, they're getting a lot of their medical information off of the news and off sites that are not giving valid information. So that was one of our intentions in doing this webinar, is to give resources like this one to within the Rotary community for you to have access to factual information. The second thing is when you get strep throat, for example, you call your doctor, you get an appointment, you go in, get tested. There is a test for strep. If the test is positive for strep, you get a prescription, you stay home from work for 3 days, maybe, and you go back to work in 5 days and you're recovered without hospitalization. If you have mild symptoms, we want you to call or get online with your community primary care doctor and get advice from them and their recommendations. The doctor's going to tell you to stay at home, isolate from your family, stay hydrated, use Tylenol or acetaminophen if your fever's over 102. And because testing is not yet widely available, the doctor may or may not recommend you be tested. The thing that's really important to know is when you should intervene and see the doctor. If you're at home with someone who has COVID-19 and they are beginning to have difficulty breathing, if you can't wake them or they're disoriented or they're confused, or if their coloring changes from pink, their lips turn blue, that is a 911 emergency. And you do not need your doctor's permission to call 911. If you have questions that are routine, a lot of the doctors will have advice nurses and they will call you back. I think the most important thing is hydration. Currently, there is no specific treatment for home care for COVID-19, and this is disorienting for our community. For one thing, they're getting a lot of their medical information off of the news and off sites that are not giving valid information. So that was one of our intentions in doing this webinar, is to give resources like this one to within the Rotary community for you to have access to factual information. The second thing is when you get strep throat, for example, you call your doctor, you get an appointment, you go in, get tested. There is a test for strep. If the test is positive for strep, you get a prescription, you stay home from work for 3 days, maybe, and you go back to work in 5 days and you're recovered. Well, the advice for COVID-19 is exactly the opposite. There isn't enough tests. We're going to tell you to stay home, not to come to the doctor, and that in many cases makes people feel unsafe. So isolate at home for 2 weeks. We know the tail of the virus is about 2 weeks after symptoms appear. Do social distancing, prevention, prevention, prevention. And the most important thing you can do to prevent this is wash your hands. If you, there's a simple recipe. You don't have to buy wipes in order to keep clean. If you put 2 ounces of bleach in a quart of water and use that, you can disinfect just about everything. Rotarians have asked the district how you can help. At RI International, there is a new disaster response fund. If you haven't yet donated, and as you know, Rotary International, every Rotarian every year, this is one way that you can help. These funds are going into a specific disaster response fund for COVID-19. In your community, there is a huge shortage of blood, and we've asked the COVID task force has identified this need, and we ask Rotarians to please go on redcross.org or download the app Blood Donor and arrange to be an individual donor or to be an advocate for someone you know. Also to call to seniors or people you know in your community or your family to check in and see how they're doing because of the social isolation that goes with social distancing. And Rotary International has a volunteer surge. You can go on globalimpact.com and sign up there. Jack?
Thank you, Aggie. Terrific job for all of you. Really appreciate all the good information. I have a couple questions that came in that I want to cover myself. One is, everybody says we should wash our hands for 20 seconds. Doesn't matter exactly how we wash our hands, and it does. I actually had planned to do a little demo on hand washing, but it's hard to do with the cast on my hand. So I'm going to describe instead the idea that you want to really wash all the surfaces of your hand. 20 seconds, if you're just kind of doing this for 20 seconds, is not going to get you very clean. You want to try as much as possible to get between your fingers and over your fingertips and your fingernails. And if you have a fingernail brush at home, by all means use that to scrub your hands thoroughly. Now, just some soap getting on your skin and having it under warm water will kill a lot of the virus, but it's not going to do nearly as good a job as if you can try to really wash all the surfaces of your hand for at least 20 seconds. That'll make a big difference. Another question that had come in that I'll take is around telehealth or telemedicine. Most people are familiar with the term telemedicine. It's been around longer. Telehealth is a newer term that means essentially the same thing. And it's been very commonly used now in some of the larger medical groups, especially here in the San Francisco Bay Area. Patients have been more reluctant, I think, than the doctors to start doing telehealth visits. It just doesn't feel like you're seeing the doctor when you're seeing them online. But now that we have to deal with this epidemic, pandemic worldwide, it's really the best way, the safest way to see your doctor. And it's being offered more and more now by physicians. And it's suddenly to our advantage to see you that way instead of having you come into the office. So I encourage folks to give that a try. You might think that the doctor really can't do that much, but I started doing it 28 years ago in a rural area where there was no other care available for the folks. And I answer the question very often, what can you do that way? Well, you have 5 senses. And I can honestly say that in my 40 years or so of being a physician, I have never tasted a patient, and I haven't smelled very many where it really made a difference. So we're down to sight, sound, and touch. And it turns out that you don't have to touch people all the time in order to do the job and diagnose the problem. With sight and sound, you have good video and good audio. Any physician can talk to any patient and solve around 80%, some say 90% of the problems that you might have. So I encourage you to go ahead and give that a try. Don't discount it as being just not good enough, but go ahead and use whatever's available from your physician or from your physician's group to take care of problems that way before you go into an emergency department especially. So on to the first of the other questions. The first one on our list is that some countries seem to have better control of COVID-19 from spreading. What does the US need to do to prevent this virus from spreading so rapidly?
I think Aggie might take that question, and I would just comment that there's pretty much agreement right now that we need more testing, and it's probably going to come fairly quickly. But Aggie, what would you say?
Social distancing is working. It's working in California. We're seeing a huge difference at UCSF from what we're seeing in New York City. And we're very grateful that Governor Newsom made an early decision on our situation in California to prevent the surge at the hospital that we have seen and heard our colleagues seen in New York. Other countries, for example, Korea, have a very different approach to public health. And they did a lot of early testing. In Korea, if you're worried well and you want to go get a test, you can walk in and get the test. You're going to have to pay for it, but you're going to get reimbursed if the test is positive. So for us, we were in the United States, and initially only the CDC was doing the tests. There was an early intervention at the federal level that allowed UCSF to set up a lab, which we did in 5 days, to staff the lab, and we're now doing 1,000 tests a day. So as we ramp up in the United States, you're going to see focusing in on two tests. One, when you're admitted to the hospital, we're going to need the COVID test to tell if you have the virus or some other infection. And then we're going to need the antibody testing to safely return you to work. So the antibody testing tells us you've had the infection. The PCR test that Dr. Sharris was talking about tells us that you're currently infected.
Thank you, Aggie. Social distancing is obviously, as you said, one of the most important things. And somebody's asking, how do we respond when community members are not respecting the stay-at-home orders?
I'll take a shot at that if I can, Jack, and say that this has actually come up in my own household, and it requires good communication. It's difficult sometimes when people have different understandings and different attitudes towards the value, but I think this is a challenge to us as a society and as a community to how we get everyone together and adopt and adapt to what's going to be necessary for at least more than another month. We don't know really how long it's going to go on, but it works. And I think Peter has some interesting slides on that that show how effective it can be. So again, the issue is how you communicate this with people that are reluctant to accept your initial attempts at explaining, and it just is, I think, a gentle persuasion.
Thank you, Rich. Somebody is asking, when the stay-at-home order is lifted, will it be safe for seniors to go back out into the public right away?
What I would say is that this order is not going to be lifted all at once, right? It's going to be phased. And my guess is, if I were in charge, that the very last group that I would lift the sheltering in place on are going to be the people who are at highest risk if they get this illness. It's a very complicated decision because essentially the way this has worked is everybody is staying away from everybody else, and that's why the transmission rate has dropped dramatically. Well, when we start coming in contact with each other, what we really want is we don't want to come in contact with people that are infectious. And the only way we can decide who's infectious is to be testing millions of people. And I'm afraid that's a long way off. And and when you do go out and about, even if we are finding most of the people are infectious, again, it's the older folks my age who are at most risk from it. And so us older folks are going to be out of this much later than younger, less risk people.
The next question was, how's your health like after recovering from COVID-19? Of the people who've had it and came through it, are they suffering long-standing side effects or difficulties?
Well, as you talked about, Jack, there's a lot we still don't know. This virus is very new. The research on how to manage this virus medically is being done all over the world. The thing that's really impressed me at UCSF is how universally all the researchers are working worldwide to find a solution, either a vaccine or some kind of therapeutic that will support those people that are in the ICU and help them manage their recovery. I agree with Peter's comment that the return to work and the return to normal is going to be a new normal, and it's going to be in stages. In California, Governor Newsom released yesterday a 6-step plan for returning to work, and we'll post that on our district website. Thanks, Jack.
Thank you. Another question is, when is it safe to donate plasma? And I assume they're meaning after you've had COVID-19 and recovered from it.
56 days after your last donation. But there's an online screening when you go on to the Red Cross Blood Donor app. So if you've donated plasma, you can donate again in 56 days. And you can either call in the 800 to schedule, or you can go online and schedule in your local community. So it's safe after you've recovered from the symptoms.
So as soon as 59 days after you've recovered, you could do your first donation?
Well, we consider you recovered when you have 2 negative PCR tests. The antibody test tells us you've produced the things that are going to help other people when you donate blood. So the Red Cross, when you donate blood, they do a whole variety of tests on the blood that is donated to tell if it can be used in that way. And if you have antibodies and you test positive for the antibodies at the Red Cross, or I know we're also, some of the larger hospitals, Stanford and UCS, are also doing those kinds of studies. But once you have donated, generally it's 56 days, you could donate again. If you've had the infection, we're going to know that because the antibody test is going to be positive, and then we can use that blood on sicker patients.
Thank you. One of our viewers is asking, does stress predispose you to catching or having difficulty fighting off the virus?
Well, I think, this is Peter, I think we know in general that people that are under a lot of stress or lonely or depressed, those folks, their immune systems don't work as well as those that are happier and more socially engaged. So, so I think the answer to that is going to be yes, at the margins. You're a little, if you're stressed out and lonely and live alone, homeless, that you're more likely to get this bug, be less likely able to resist it.
A related question is, what programs are in place to address the mental health issues that'll result from both the economic crisis and the healthcare crisis itself and all the fear that people are living under?
So Aggie, I know that being an old style medical doctor, when I was in medical school, we never talked about mental health. But boy, when I watch UCSF, there are all kinds of programs and everybody's talking about it. So why don't you take that one?
Well, when my family asks me how to manage stress with this, I tell them to stop watching the news, to put on some music and go out and get some activity, because the antibiotic for stress is physical activity. I think there's a lot of fear propagated by a lot of facts that we don't know. Our relationship with this pandemic is very young. We're learning something every day. The recommendations are being updated. The situation is very dynamic one, and that's causing a lot of stress for people. So there's that, the risk of getting infected or your family getting infected, and there's also the economic impact. The Surgeon General has a playbook, and we'll post some of the resources on the site, but I would say in general, stop watching the news, start listening to music, get some physical activity, and do something that sparks joy for you.
Like, one of the questions that strikes fear in many people's hearts is the situation with nursing homes. And one of our viewers is asking, should I consider pulling my mom or dad out of the nursing home? If so, what are the risks and consequences I need to consider?
Jack, I think several of us could comment on that, and I have that situation in my family and that concern. And there is, you can go on the websites and actually learn each of the nursing homes where there's been a case of COVID-19. Obviously, you want to communicate yourself if you have a loved one in a nursing home to find out if there have been any cases. As we all know, many people are coming in to take care of the folks that are in the nursing homes that may or may not be symptomatic or asymptomatic. And so my quick answer to that question is frequent contacting if you have someone in a nursing home to make sure that everything is staying good. And once again, this is where you may want to talk with your regular medical doctor or some physician who can best judge the risks involved. But I think that's a critical decision for any family as to when they would want to make arrangements, because sometimes it can be difficult at home too.
I agree with Dr. Godfrey. It's a personal family decision. First of all, you've got to, I believe, consult with the patient's primary care physician, because the care that this individual is getting at the nursing home might not be something that you can provide at home. And there would need to be a plan of what to do after the patient gets to your residence. The patient may be there for 2 years. This is a an epidemic that all of us in the medical professions feel that we're running a sprint, and it's an ultra marathon race. So I think it's a personal decision. I think the isolation of them not being able to be visited has been handled by family members doing FaceTime chats and talking to them through the windows and that kind of thing. But this is an individual, personal, family decision. And as Art was talking about with the kids, sometimes the kids are asymptomatic and can be vectors to the older adults. So you can bring them out of a safe situation in the nursing home into the residence around the grandchildren and actually expose them to an asymptomatic family member. Peter, do you have any thoughts on that?
Yeah, the only thought I would have is that I know that the long-term care facilities are really struggling because the government has not provided them with adequate guidelines as to how to protect people. They tend to be, just doing it on their very best. So, as a family member, you can help that nursing home come up with its own guidelines that are going to help protect parents. As an aside, I have a 99-year-old father who is living on his own at home, and we've been worried about that for years. And so now it's, I told you so, I told you so, I told you so.
It was interesting this morning. There was a feature on the forum program on KQED radio and public radio. Michael Krasny had several guests on and took a number of questions from listeners about that topic of nursing homes. And if anybody wants to follow up more on that, they spent a full hour discussing the topic. That's usually archived by about the next day, I believe, and maybe even the same day on KQED radio. The next question is, we've been hearing reports of workers at meatpacking plants and produce distribution centers having COVID-19. How can we be certain that our families won't get the disease from food or food packaging? I'll start that one out and then ask somebody else to jump in with more detail. So a good rule, I think, now is to go ahead and wash everything when you bring it in from the grocery store. Be careful with the packaging, the bags that it's in, because that could be exposed. And be careful with the fresh produce, with the cans and bottles and everything else. And wipe everything down with a disinfectant. Something like Lysol appears to be useful, or dilute bleach and water can do the job, or alcohol if it's at least 60%, and rubbing alcohol is usually 70 or 91%. So wipe everything off.
Some things. What we're doing in our community is we're letting the delivery that's not refrigerated sit out for 24 hours, and usually that time, a day or two, for example, the mail and that kind of stuff that doesn't have to be refrigerated, usually at the end of a day or two, the virus is not able to survive well outside the body. It's actually very friable. On the refrigerated items, I agree with you, wiping them off before you refrigerate them or repackaging them would be a good alternative. Peter?
And so I personally have a dilute bleach, which I put on a towel. Any package that comes into my house gets wiped off before it gets put into a bag that's brought into the house. And that's going to take care of it. The meat itself, which you're cooking, and the center of the meat, which has not been touched by human hand, that's not going to be infectious. So that I agree with the wiping off with bleach, Lysol, alcohol.
Great, thank you all. Let's talk for a moment about other things that people can do to protect themselves. I had an experience this morning. I had to go see my orthopedic surgeon about this, and I was really nervous about walking into a large medical center and sitting on the furniture and having an x-ray done, some hand on the table and sitting on their chair. And I'm a bit compulsive about this. I think it's too many years in medicine, too many years looking under a microscope. But I changed clothes as soon as I got home. I actually sprayed my shoes with Lysol before I got into the car, and I covered the car seat with dry cleaner bags, both the seat and the back. And I was pretty compulsive, but I came home feeling like I was really safe, like I hadn't been compromised because I was that careful. And I'm really thinking that maybe that's what most people should be doing if they possibly can, to prevent the possibility of bringing bugs back to your home. And any other comments on that? Am I being too cautious?
Jack, I'll add a little bit to that because we've had, I think, in a number of families, different points of view, and particularly among the younger people who probably don't feel the same amount of risk, or they may be the young guys who are definitely not risk adverse. I would comment some studies that have come from the virologists on these issues. Do you have to wash your clothes when you come home? To me, that was hard for me to completely accept. And so Lindsay Meir from Virginia Tech aerosol virology scientist, basically, along with Andrew Janowski, says that it probably is a little bit, well, let's just say that it's unlikely that the virus can transmit from clothing, assuming that you haven't been in the contact with somebody who's sneezing or put you in contact with droplets. The likelihood of that is extremely low. So I would say that there's a balance to this. I think each of us has to make our own individual decisions, sometimes with our wife or our husband, or whoever else has to go through the same criteria. But at this point, there hasn't been a strong argument on going to the point of literally, well, let's just say maybe it's a good idea to remove your shoes and walk in the house with your socks, but you're probably going to be bringing in more bacteria in the bottom of those shoes than you are virus. So there's just one side, another side to that topic.
I agree with you, Rich. And one of the things that I'm really happy about for this opportunity with the webinar, is we can put out some of the factual based resources for our community. So here on the CDC website, there are some recommendations on what you should be doing when you're out in the community. What we're doing is we have one family member who's not a high-risk person running the errands, and we lump the errands together so we're not going out multiple times. We've minimized use of public transportation, so we're arranging rides and doing that kind of thing. And then during the time that we're in the vehicle, we have the windows down, we have a face mask on, we have cloth covering on. So go to the CDC website. There's a lot of information there on what you can do. Remember that in order for the virus to become, for the person to become infected by the virus, it has to be in sufficient quantity. So there's not a lot of evidence that you can get yourself infected from opening the mail.
Thanks, everybody. I feel better already. Another question is, how can we care for someone in our own home who has tested positive for the coronavirus, whether or not they started showing symptoms? How can we care for a loved one who is tested positive and keep ourselves safe?
Peter, that's probably a better question for you.
Yeah.
I would point out when I came back from Sierra Leone and working with Ebola that I spent 2 weeks in isolation, and my wife was kind enough to bring food, but we never had direct contact during that period of time. You know, I had the benefit of a beagle that spent time with me, but it can be a little bit lonely. So you're going to deal with a little bit of stress from that too. But medically, I think Peter's better qualified to answer that question.
Yeah, and I would say there's clear guidelines on the CDC website for how to take care of that. But essentially, and it's extremely difficult for lower income people who are living in a house with multiple other people and one bathroom and one kitchen. It's not possible, I don't think, for many people to follow the guidelines. If you're fortunate enough to live in a house that has separate bedrooms and a separate bathroom, the guideline calls for that individual to isolate themselves in a bedroom, to use a single bathroom, to use completely different utensils, and to stay there. And for the individuals that are providing food, to leave the food at whatever line you set, and that do separate clothes, separate bed linens. There's a bunch of questions on how are we going to be able to get back to work? What kind of testing are needed? What kind of protocols are needed? What I would say is that there are now clear CDC guidelines for how businesses should operate themselves to try and to make it more likely and more possible for them to get back to work. They're recommending taking temperatures on admission. The people have to maintain social distancing at work. You have to change the workstations. There are a whole series of guidelines about masks, about how to try and do that. But the bigger question is, are we going to be able to test people, find that they're immune, and then give them an immunity passport? That's been talked a lot about in Europe and in Italy. And I'm not optimistic that we're going to be able to do that in this country. What I do know is that some jurisdictions, such as San Francisco, have decided that they are going to be very aggressive about case identification, case tracking, and testing and immunity testing. But there are other jurisdictions in this country where I'm just not detecting any enthusiasm for that. It's terrifying how what is really a scientific issue and a public health issue has gotten into the political arena.
Another issue that's arisen in that regard is the question of herd immunity. And maybe, Peter, you could handle that too.
Yeah, herd immunity, in order for herd immunity to work, you have to have 90, 95, 97%, I think it's 98% of people immune from measles in order to prevent measles from becoming an epidemic. So we simply can't have 90% or 95% or 95% of this country get this bug, because there are going to be millions and millions of people that will die from it. Now, I know that people have been reading about the Stanford study where there may be 50 to 100 times the number of cases than have actually been reported. I'm sure there are a lot more cases than what have been reported and have been diagnosed, but I'm troubled by the way they got patients to enter that study. We're going to have the epidemiologic studies that are done. I know Stanford's doing 1 million people. I know UC Berkeley, I was talking to them the other day, they're doing a big epidemiologic study. So we will find out soon, probably within a couple, 3 months, just how many people in this country have had it, but it's not going to be 90%. I'm really sure of that.
Peter, I might just question, I've been reading and having interest in this, and there's an R naught for all these viruses, and the COVID-19 may in fact not require quite the same degree of immunity that measles does. And I'm not going to quote those figures, but I think it's worth waiting to see what comes out in the month ahead. One of the other questions, though, comes back to testing, and you may know the answer to this better than I do. The question came, when will we have more testing available in Santa Clara County? And I do believe, from what we're hearing from the governor, he's really communicating almost every day starting at noon and giving pretty good information on it. So we're seeing a marked increase in testing coming available now, literally each day, each week. The analogy's been thrown out. It's kind of like we're flying in an airplane and building it as we fly it, but we're getting a lot of those parts very quickly. So hopefully we'll be up in the air and we're going to land properly. And I think that testing, there's a number of different varieties of testing that are becoming available, including Abbott has one out now that theoretically can test you in 10 to 15 minutes. They've built 5 million units. They're shipping them out. And you can be sure that this is being ramped up by multiple industries right now. So to answer that question, I think if you were to communicate with any of the providing, the county or Kaiser or any of the basic medical suppliers in that area, that you'll find testing is going to probably become much more available soon.
I agree with you, Rich. Testing has got to be part of the factor. The antibody testing will tell us if the person has immunity, and I think that will be a part of the program. And we'll post the governor's 6-stage return to work phase. I think this is going to be phased in gradually over weeks and months. And social distancing in the workplace is going to have to be a factor in the return to work as well. Jack?
Let's shift a little bit here in our emphasis and talk about treatment. A lot of questions these days about the evidence regarding treatments for COVID-19, especially 2 drugs have been brought up, hydroxychloroquine and remdesivir.
Sure, I'll take that. So the issue with hydroxychloroquine is that we still don't know whether or not it works. It's being studied aggressively in lots of different places. One of the problems with chloroquine and hydroxychloroquine is both of them have significant side effects, cardiac side effects. And so chloroquine study in Brazil was abandoned because they had patients getting cardiac problems. So we're going to have to wait and see But as I understand it, that the studies are not really convincing at this point that it has much of a clinical effect. But we're going to find out. It's certainly not a magic bullet. It's not something that you give to someone and they get better. That's for sure. Remdesivir, there's a couple of studies out. They're small. They do show that patients seem to do a bit better when treated with remdesivir. And so we will find out more as more and more of these studies are done. There are other studies. There's a drug coming from Japan, which is being studied, whose name I can't remember. It begins with an F, in Boston, and has been studying in Japan. And so we're working on it, but we don't know yet what works.
Well, I'd like to add that there is information on the CDC website regarding therapeutics for COVID-19. The drugs that Peter mentioned are being used off-label. There are 69 FDA-approved medications that may have a factor in helping treat COVID-19, and there's ongoing research for them happening all over the world, and that information is being shared. So at this time, those drugs are being used off-label on a compassionate use basis. There is no antibiotic for this virus. There is no vaccine for this virus. So the best way to treat it is to prevent your exposure by following the community recommendations. And also we'll post on the website, the district website, the governor's 6-stage plan if you haven't seen it on returning California back to work. Thank you. Jack?
One of the most famous couples in the country or in the world to get COVID-19 was Tom Hanks and Rita Wilson, his wife. And they were in Australia, I guess, on a movie set when they contracted it. They both were hospitalized. And I read that Rita Wilson was treated with hydrochloroquine and had some pretty horrible side effects from it. They weren't really certain whether she got better any faster because of it, but they were not very happy about the side effects, basically. So I think everybody's really eager to have more information, but we just have to understand it's going to take a little while to get some real randomized control studies that'll tell us and sort it all out from the anecdotal stories, like what I just said, versus what we can determine through real scientific methods. So we're rooting for the guys who are doing those studies. It's so important. Somebody else asked, how well has Sweden's liberal COVID-19 mitigation approach been working? Could this work for parts of the US that have lower infection rates? Peter, can you handle that?
Yeah, I can handle that. So Sweden actually has a higher death rate than we do in the United States. It's a social decision that they've made. They decided to concentrate on a different set of public health measures than we did. They decided not to do the aggressive sheltering in place that we had. Now, they started out at a much lower level of infection than we were at, which is why we had to do social distancing to bring it down. And they are tolerating a higher death rate by about 50%. At least that's when the last time I looked, 50% higher, and 4 or 5 times higher than the death rate that is happening in Denmark and some of the other Scandinavian countries. But they are allowing bars and restaurants to be open. They are keeping their older folks, people who are at higher risk, they're advising them to socially distance aggressively. They are advising masks, and they are watching very, very closely because they might get into more trouble rather quickly.
Well, I have a slide that we discussed in our task force meeting. Social distancing in San Francisco is working. We're seeing here the difference between the Bay Area numbers of cases and Los Angeles County, Southern California, that the sheltering in place does get the results of reducing the number of infections. And that information is also available on a variety of websites, including the Johns Hopkins website, which it talks the number of cases. At UCSF, we're looking at the death rate and the hospital admission rate as a way to know that the social distancing is working.
So Aggie, if I could leave that slide up.
Yep.
Because I really love this slide. It shows us a couple of things. Now you have to remember that the population of Southern California is, I think, quite a bit, it's almost twice what the population is in the Bay Area. But if you look at the very beginnings of these slides, if you look, you'll see that I have the social distancing measures, the very aggressive social distancing measures, I believe in the Bay Area, started on March the 17th. And they didn't start in Southern California until March the 22nd. And if you look at those early numbers of cases, they aren't that much different. But because Southern California waited 5 days, they got a much bigger increase in the number of cases.
Thank you. Somebody asks, I have a couple of N95 masks left over from last year's fires. Can I wear those in rotation after airing them out in the sun?
What I'm reading and being told is that you probably need to, it is probably a good idea to leave them out in the sun, but ideally they have to be out for close to a week before you have absolute assurance. Now, we know from some of our studies of the virus that in cardboard and some of these materials, the virus doesn't last as long, maybe as little as 24 hours. But with masks, I think we're being, obviously, you have to err on the cautious side because it's going to be right next to your respiratory tract. So that's a cautious answer. But if you have two masks, then you might want to invest in getting some other masks as well, or at least spread them out for close to a week before switching the masks.
So Peter, so they have actually been looking at, I mean, obviously hospitals are in desperate need of N95 masks, and they have actually been looking at various ways. The most effective way is to use a hydrogen peroxide mist. That seems to damage these masks the least, but it's not something that an individual can really do. They also used ultraviolet light and a couple of other techniques, but those other techniques tend to destroy the masks very quickly.
The surgical masks that you see being worn in the hospital, those are single-use, one-time masks, which makes the cotton manufactured masks a little more reasonable in that they can be washed and reused. And there are people that are taking the HEPA filters from bags like vacuum cleaner bags and slipping them in the pocket of the cloth mask and actually making them a little bit more effective.
Interesting question. Are open cuts on our hands an issue? It's reported that coronavirus is spread by inhaling it. What about through open cuts? And corollary to that, somebody was talking about using hand sanitizer so much their hands are drying out and starting to crack. Would that be an issue too in terms of exposure?
This is an airborne virus. The portal of entry is respiratory. We have not found anything in our early research that shows this to be a bloodborne virus like HIV was in the 80s. Some of the fear that I'm seeing is being generated by the media reporting on this, counting deaths and reporting numbers of new cases studied, and are bringing back lots of memories about my experience in the Navy during the HIV initial phase of the viral epidemic. That was bloodborne. This one has, there's no evidence at this point that shows it's anything other than a respiratory droplet or direct contact virus. Peter?
Yeah, no, I agree with that. And I too cut my teeth during that terrible period of time where we were starting to see young men die and we had no idea why they were dying. It was very terrifying, and this one's a bit like it.
I might add to that what do you do to protect your respiratory system? And there's interesting studies going on right now about the microbiome of basically the cilia in your respiratory tract. So obviously people that have suffered from emphysema or who are currently smoking tend to have much more difficulty fighting off this virus. And so anything we can do, it raises, I think, the question of, is it a good idea to exercise? And obviously that has to be done with moderation, but you want to basically enhance your respiratory system in any way that makes sense, as well as your immune system in general. And clearly, if there's ever a time to quit smoking, this has got to be it.
And vaping also with our young adults is shown to be a risk factor with COVID-19, increasing their vulnerability. So I second the motion, Dr. Godfrey. If there was ever a time to quit smoking, this is the time. Jack?
Fully agreed. Other Question here, again, a little shift in topic. If you put packaged food into the freezer and don't consume it for a while, are you protected?
Yeah, I think I mean, wipe the package. That's what we've been suggesting. And but again, we know that this virus doesn't last for weeks, right? It may last for a few days on some packages. So if you put it in your freezer for a week or two, yeah, it's very unlikely that you're going to get any viable virus off of the package.
We talked a little bit about masks, the N95s, and a lot of people now are making cloth masks since we want to try to keep the N95s and even surgical masks for the medical community. What about cloth masks? Are they doing the job?
I can partly address that and also point out you can go to YouTube or you can just Google this subject of how to make a mask and get really excellent instructions on how to do it. And there are different ways of doing it, obviously, and determining what you want to put in between two layers of cloth. So that will impact how effective the mask is. Again, we think that it is not as good as a surgical mask. Maybe there's some data on that and suggests maybe 30% less efficient. But that being said, it probably is more efficient in protecting someone who's sneezing or coughing and spreading droplets in any form. And then I guess we'll know more in terms of whether there's weaknesses in those cloth masks, but there's no disadvantage.
Yeah, I just have to go back to the fact is, you know, surgeons and people in operating rooms have worn masks for years, right? And they're not wearing it because they're worried of getting something from the patient. They're wearing it so they don't give something to the patient. And that's the reason for wearing a mask. And so as a public health person, what I'm hoping is that in this country, we adopt the same social norms that have been adopted in Asia, which is that people basically wear masks all the time because they're protecting each other.
My family asked if they needed to put masks on when they were out in the park taking a walk, and they were able to maintain social distancing, unlike you could do at the grocery store. So recently, Fremont issued an executive order that face masks will be required to be in the grocery stores and out in the community where you cannot make social distancing available. You can't guarantee that, so wear a mask. But if you're in the park or out where you are engaging in the outdoors and you're not around people in close contact, I'm not sure that a mask would help.
Thanks. Another mask question. Somebody says that listeners should be cautioned that some HEPA filters contain fiberglass. Anybody aware of that?
Yeah, I was thinking about putting a vacuum bag over my face, but now hearing that, I don't think I will.
Some people are using filters from furnaces to cut them up and use them in the homemade face masks. So I would say the CDC guidelines would be best. I'm seeing t-shirts and other resources for the masks that are being made, cloth, cotton fabric. But yeah, you have to be very careful what source you use if you're using a HEPA filter.
I would think the furnace filters would be pretty coarse. We're getting some stuff out, but it takes about an inch thick or so at least a half an inch thick to do that. So I'm not sure that'd be a practical solution.
Yeah, my furnace filters are 3 inches thick. So
yeah, it'd be a little bulky on your face. Somebody's asking about in terms of telemedicine and telehealth. Some medical centers are proficient in providing telemedicine support. Do self-auscultation devices help in speeding up the screening process without having to go into the hospital? In other words, if you have an electronic stethoscope type device at home, would that be helpful for the physicians that you'd be connecting with at the hospital or the doctor's office?
Well, I'd like to take that one initially. The things that I use at home, I use a thermometer that I can read, and there's some electronic types you can hook into your phone as well. But I use a thermometer to monitor temperature once a day. It should be under 100.5. That shows that you're not ill. The other thing, rather than a stethoscope, that I like is the pulse oximeter, which runs around $40 at the pharmacy, and that gives you your oxygenation in your lungs, which I think is also a very objective, reliable way to know how you're doing if you're having difficulty breathing. And then the third thing I use is a wrist cuff. It's not as accurate as the one we use in the hospital, but it gives you some indication of blood pressure. So that way you give them on your televisit the temperature, if you're having symptoms like shortness of breath, your pulse ox, and your blood pressure. And that's a good beginning for us to triage you.
Can I add something here, Jack?
Yes.
We also were approached by a company called Kinsa, who manufacture digital thermometers, and they have offered to distribute these free to many school children who need that in our school districts. So we are spreading this word among the presidents and the assistant governors in our district so that they can make use of this offer from Kinsa, and that they're good digital thermometers which can be distributed to the school districts who need them and the families thereof who will benefit from that.
The interesting thing about that to me is that they are electronically connected. Basically, they're internet connected, so that this company Kinsa can tell, it's anonymous information, but it can tell where there are clusters of people that have a fever. It may be useful information for research, but I'm not sure how effective that will be. What I do know is that if we can get more kids having thermometers at home, that'll be that extra bit of information we'd love to have when mom or dad call in and ask for help. If little Johnny is have a temperature of 104, then we're going to be much more excited than if he's at 98.6.
I think in that and by itself, I think it's a very good benefit to have those digital thermometers around here. The way to connect to the internet is an opt-in feature. So if these people do not want that data to be shared, even anonymously, then they can opt out of it. So that's the catch to that. But I think, like you said, it's a great benefit to have those digital thermometers. What you cannot measure, you cannot monitor. What you cannot monitor, you can control. So I think this is a good way to measure it.
Well, and since the person may be asymptomatic and infectious up to 2 days before their fever occurs, the fever is only one part of the equation in monitoring someone for COVID-19. So the cough, the fatigue, people who've had this virus talk about just an unbelievable fatigue that they can't move and can't get out of bed. So I think fever is a good marker to use, but it's not the only marker clinically.
I'm going to swing back to another mask question that just came in. Somebody else says they have some leftover from last year, masks that is, N95s, but they have a valve on the front, and he wants to know if those are effective at preventing infection, or are they just a little more effective than a dust mask?
I'll hazard a answer to that in that I don't know if we really know yet what degree they're helpful. There is a professor out of Stanford that argues that they may diminish the amount of fomites that come from outside in. Obviously, they will probably give you some protection against droplets, but I think the bigger question is fomites when you're in the aerosol region. And so the N95s probably are as maybe significantly effective in blocking those viruses and coming in. Not so much with the cloth masks, obviously, and even some of the surgical masks. So my answer to that question is that there probably is good reason why these countries like South Korea and Taiwan and Singapore and other places where they've had to deal with endemics, that everyone wears a mask and it seems to help them. And part of it may be due partly to the ability of masks to prevent viruses from penetrating in, but we don't have really prospective studies answering that question. Peter, maybe you can comment.
Yeah, I think the valve that you see on the front of some N95 masks, those are industrial masks, and the purpose of that valve is to make it easier to exhale. I think the valve opens up, and then when you inhale, the valve closes again, so you're not inhaling dust. So I actually think those valved N95 masks are probably increasing the risk that if you are infected, you might transmit it, that you could transmit it.
I agree with you, Peter. The other factor, as we've talked about on our committee meetings for the task force, is the N95 can't be seated properly when the male has facial hair. And so there's alternatives in the cloth mask area that may be just as support the person when they're out in the community. The N95s, I think, and the KN95s are geared more toward an inpatient hospital environment in an ICU where there's a high, or an emergency room where there's a high risk of exposure. The communities that are writing executive orders for masks to be worn when you're out and you can't maintain social distancing, they're talking more about a cloth mask or a one-use disposable surgical mask.
I think we pretty much got all the questions that I can see.
Yeah, pretty much. There are a couple questions about donating blood, and that's something we should talk about, I think. One of the first projects we took on as a task force a few weeks ago was to try to help the Red Cross, and Stanford for that matter, who are both way behind on getting blood donated because so many of the places where they normally do it, like schools and places of business, had to shut down because of the lockdown. They were thousands of units, many thousands of units behind their schedule in terms of stockpile, and they do expire after a while, so they needed to have more. Los Altos Rotary, my club, jumped on it pretty quickly. The assistant governor for our area, who's in our club, Frank Verlat, got busy and called up people at the city and people at the school district and was able to arrange some spots. And now they actually, I guess, have enough places to do blood draws for the next few months. They are still looking for more donors. So I encourage people to sign up, and you can find that information also on the district website. A couple questions that just came in about that is, I'm 70 years old. Is it safe for me to donate blood? And somebody else says, many Rotarians of a certain age are on aspirin or blood thinners. Does that mean they can't give blood or plasma?
So the short answer is no, that doesn't mean they can't give blood or plasma. There's a self-assessment that you do when you go on the website or call the 800 number that is one level of assessment. And then when you show up to donate, there's another level of assessment and a consent form that's signed. So I think it's an individual thing. So age is not one of the criteria.
And they've altered the way they function in the blood bank labs so that 70-year-olds, you're going in with an appointment, you're maintaining social distance. So yes, the answer is safe as a 70-year-old to donate blood.
Thank you. We're getting close to the end here, and I've been trying to avoid the more political questions, of which there have been a great many that are inevitably would involve politics in the answer. But there's one that I think is really important that is in the news right now. What if the U.S. government stops its support for the World Health Organization? What are the likely consequences for that, both for people in developing countries and here in the U.S.?
Devastating. That's the bottom line. It's the WHO didn't hide this from people, in my opinion. Chinese have been not as responsive, not as honest, not as open as it would have been helpful if they were. But the WHO is hugely important around the world. If you want to learn more about it, look for what Bill Gates has to say about the WHO. He's been a huge supporter of them for many, many years, and feels very strongly that this is not a smart thing to do in the time of a pandemic.
Peter, I totally agree. And I would look back to the time of Ebola and say that there was a lot of criticism back then for the response rate and what WHO did. But the long-term outcome was they were critical in stopping that virus and continue to be critical, not just in COVID-19, but other viruses that we may be facing in the future.
I mean, if nothing else, we've learned from this that we're all in the same boat together, that this is now an international virus. It started in one spot and now it's everywhere. And so there has to be some organization that coordinates our worldwide approach to these kinds of public health crises.
We hear the expression, we're all in this boat together, all in the same boat. And that's not quite true in that some of us have pretty comfortable boats, especially here in the Bay Area, I would say, where even though Santa Clara and San Mateo counties had very many cases, it looks like we are in fact turning that around to a great extent due to the social distancing. I prefer the term actually physical distancing because social distancing implies the fact that we are losing touch sometimes with other folks. It's hard to be home by yourself or even home with just a spouse. And spousal abuse is on the rise, partly because of that probably. we need to find ways to bridge those gaps. And many of the clubs now, partly I think because of the stimulus from the task force actually, asking clubs to do it, and a lot of clubs did it on their own. They're calling everybody, especially the folks that can't make it into meetings and can't even make it into the video meetings that they've been doing now. So some clubs are calling every member once a week or once every other day or maybe even every day in some cases. Meeting is also, I think, important. When we started dealing with this about a month or so ago in our club, which is fairly progressive in terms of technology, being in the middle of Silicon Valley in Los Altos, a number of people were saying, well, we're just going to have to do a dark for a while. This video conferencing stuff is for the birds. We're not going to try to do that. And a few of us pushed for it, and we showed the folks how it could be done fairly easily. And we didn't skip a meeting. We ended up being able to go right on. We had a meeting one week, and the next week it was on video, and we had more people there on video that first week even than we had at our average meetings before that. And it's gotten a little better every week since then. And even the folks who are saying, oh, no, I can't do this, are now saying that they're enjoying these meetings as much as they ever did well, maybe not as much as they ever did the ones in person, but they're really enjoying them, really think they're valuable. And the point of all that is I really want to encourage all the clubs in our district to think about that. If you haven't figured out how to do it, Arlie Marley, past district governor who runs the website for us, has just created a document that I think he's already sharing to at least the assistant governors and maybe to all the club presidents, that gives you a menu of things to do in order to make a Zoom meeting happen for you. You could use other kinds of video conferencing as well, but Zoom's the one that a lot of us have used with good results. So if your club is not doing that, talk to the president and the other folks on the board and see if you can't maybe make it happen, because this is not the time for Rotary to go dark. The world needs us, we need each other, and I want to encourage you to try to make that happen in your life.
Yeah, I'd like to say one other thing, and that is that these virtual conferences open up huge opportunities. For instance, we happen to be the third oldest club in the world. We have gotten together with the first 5 clubs in Chicago, Seattle, San Francisco, Oakland, and LA. We are putting on a joint meeting by Zoom with Mark Maloney as the president of Rotary International as the featured speaker. So we're going to probably do more of these, and we'll probably open them up to other clubs as well. So we can really do some new and interesting and fun things.
I agree with you, Peter. There's many ways Rotarians can get involved as individuals, as the clubs, in the area level through their support of their area governor, and certainly with the district. I think that if you stay in contact with each other, you'll find ways to help. And if a lot of Rotarians have asked me, is Rotary going to get involved in testing? Well, through the disaster relief fund that Rotary International started, that is one way you can support testing and other things that will be done. We're seeing at UCSF a huge grant from the Zuckerberg Foundation that will open up testing at the public health sites with the doctor's prescription. So there's going to be ramping up of both the PCR test as well as the antibody test in the future.
Jack, I think it's 2 minutes past the time, and I thought this might be the time. I'll have a few closing remarks, if that's okay with you.
Absolutely. I'm just going to hand it off to you.
Yeah, thank you so much. Basically, I think I just want to reiterate to all the Rotarians that knowledge is empowering. And what we have seen is this outpouring of knowledge, this expertise that you've just experienced is supreme. And in this medical field, it's difficult to have unanimity, but as Rotarians and doctors, these people have had a consensus. Several meetings took place in preparation to today's webinar, and they've done an outstanding job. They've been authentic, they've been sincere, they've been honest, they've been candid. So I hope you benefited by this program. Learn and serve your community, and the recordings are available. Please share these recordings with other people who will also benefit by this program. Stay safe, stay well informed, stay connected. Thank you for attending this town hall webinar today. Have a great night.
Thank you, everyone. Bye-bye.